So this is the reason why Zopiclone should not be taken long term. I'm Dr. A GP based in the UK, and Zopiclone is one of the most commonly prescribed medications here in the UK, but here's why taking it long term can cause more harm than good. So Zopiclone basically works on the GABA receptors in the brain. It reduces the excitability of the nerves and makes you feel more relaxed and hence fall asleep. And it is very effective and it will make you fall asleep, but ideally it should not be taken for more than 2 to 3 weeks, but here's why. That's because any longer than this you're at risk of getting a dependence, which means you need it to fall asleep, and without it you cannot fall asleep. And if you try and cough it too quick, you start getting withdrawal symptoms. Now, withdrawal symptoms can be mild to severe, but they can include insomnia, anxiety, sweating, palpitations and tachycardia. And in very rare cases, you can even get hallucinations and seizures. So you can see why we try to avoid giving it long term. However, if you're someone like the person in this comment who has been in a long term, has tried coming off it, but they can't, how can you come off it? Well, the key is doing a reducing regime that's tailored to you. And this can take months or even years in some cases, depending on how long you've been on it and if you have any withdrawal symptoms. Now, everyone's different, but generally with my patients, I reduce the dose every couple of weeks and see how they respond. If they have a rebound effect, I go up the dose again and then go down again every couple of weeks. And this generally has a good way of coping with any withdrawal symptoms while coming off it very slowly. And like I said, this can take months to years, but most commonly it takes about 2 to 3 months in total to completely come off it. So again, I'll say it again, and I've said it so many times, if you're having trouble sleeping, sleeping pills are not the long-term answer. First, you need to find out why you're not falling asleep, and then there's lots of things you can try before trying sleeping tablets to see if they work.